Pituitary adenoma is an endocrine disease. Look at this picture, shows that tumor in pituitary gland, then CT scan and MRI of brain is gold standard for detecting adenomas. Look at this findings. Detail going on. Introduction. The pituitary gland, often called the master gland, plays a crucial role in regulating various hormonal functions in the body. A pituitary adenoma is a benign tumor that arises from the pituitary gland. While these tumors are usually non-cancerous, they can cause significant health problems due to hormonal imbalances or pressure effects on surrounding structures. Early diagnosis and appropriate treatment are essential for preventing complications and ensuring a good quality of life. A definition. A pituitary adenoma is a slow growing benign tumor that develops in the pituitary gland. These tumors can either be functioning, hormone secreting, or non functioning, not producing hormones. They vary in size and impact based on their hormonal activity and location. The term pituitary adenoma comes from pituitary, referring to the pituitary gland, from the Latin pituitarus, meaning mucus, due to early misconceptions about its function, and adenoma, which is derived from the Greek duodeno, gland, and oma, tumor, indicating a benign glandular tumor. Together, pituitary adenoma describes a non-cancerous tumor arising from the glandular tissue of the pituitary gland. Types. Pituitary adenoma are classified based on their size and hormone secretion. Based on size, 1. Microadenomas less than 1 centimeter in diameter, often asymptomatic. 2. Macroadenomas greater than 1 centimeter more likely to cause symptoms due to based on hormonal secretion. 1. Functioning adenomas secrete excess hormones subdivided into A. Prolactinomas secrete prolactin leading to galactorrhea, amenorrhea, and infertility. B. Somatotroph adenomas secrete growth hormones GH causing acromegaly or gigantism. C. Corticotroph adenomas secrete adrenocorticotropic hormone leading to Cushing's disease. D. Thyrotroph adenomas secrete thyroid stimulating hormone TSH causing hyperthyroidism. E. Gonadotroph adenomas secrete luteinizing hormone LH or follicle stimulating hormones FSH, often asymptomatic. 2. Non-functioning adenomas do not secrete hormones but may cause symptoms due to compression of nearby structures. Causes. The exact cause of pituitary adenoma is not always known, but factors include 1. Genetic mutations, 2. Sporadic development, 3. Familial syndromes like multiple endocrine neoplasia type 1. Risk factors. Certain conditions may increase the risk of developing a pituitary adenoma. 1. Genetic predisposition. MEN1 chronic complex. 2. Hormonal imbalances. 3. Radiation exposure. 4. Environmental factors. Complications. If left untreated, pituitary adenomas can lead to 1. Vision loss, compression of optic chiasm. 2. Hormonal imbalances, hypopituitarism. 3. Infertility. 4. Diabetes insipidus. 5. Cushing's disease. If ACTH secreting. 6. Acromegaly or gigantism. If GH secreting. Pathophysiology. Pathophysiology of pituitary adenoma step-by-step process. 1. Genetic and molecular abnormalities. Mutations in genes regulating cell proliferation. Example MEN1, USP8, GNAS lead to uncontrolled pituitary cell growth. Dysregulation of signaling pathways such as CAMP, PKA or MAPK contributes to tumorigenesis. 2. Uncontrolled proliferation of pituitary cells. Normal regulatory mechanisms fail, leading to monoclonal expansion of a specific pituitary cell type. Loss of feedback inhibition from the hypothalamus and target endocrine glands enhances abnormal growth. 3. Formation of brain tumor adenoma. A slow growing benign adenoma forms within the anterior pituitary, most commonly from lactotroph, somatotroph, or corticotroph cells. Tumor size varies from microadenomas less than 10 millimeter to macroadenomas more than 10 millimeter, affecting local structures. 4. Hormonal overproduction or deficiency. Functioning adenomas overproduce specific pituitary hormone, leading to symptoms like acromegaly, GH, Cushing disease, ACTH, or prolactinoma, prolactin. Non-functioning adenomas do not secrete hormones but cause symptoms through mass effect. 5. Local mass effect and compression symptoms. Expansion, compression nearby structures leading to headache, optic chiasm, compression, and cranial nerve dysfunction. Large tumors can impair normal pituitary function, causing hypopituitarism, a deficiency of multiple hormones. 6. Systemic effects and clinical manifestations. Hormonal excess or deficiency leads to symptoms such as gigantism, acromegaly, when GH excess, hypercorticolism, is ACTH excess, or hypogonadism, FSH or LH suppression. Metabolic and cardiovascular complications arise from endocrine imbalances. 7. Progression and complications. If untreated, tumors may grow inward adjacent structures or undergo apoplexy, hemorrhage, or infarction within the tumor. Chronic endocrine dysfunction can lead to osteoporosis, diabetes, and cardiovascular disease or infertility. Pituitary adenomas results from genetic mutations leading to unchecked pituitary cell proliferation, hormone dysregulation, and mass effects on surrounding structures, ultimately causing a diverse clinical syndromes based on hormone involvement. Signs and symptoms. Symptoms depends on the type and size of the adenoma. Hormonal symptoms. 1. Prolactinoma, galactorrhea, amenorrhea, infertility, decreased libido. 2. Growth hormone secreting adenoma, acromegaly, gigantism, mainly in children's. 3. ACTH secreting adenoma, weight gain, moon phase, Cushing's disease. 4. TSH secreting adenoma, hyperthyroidism. Symptoms: tachycardia, weight loss, compression symptoms. 1. Headache. 2. Visual disturbances. 3. Fatigue. Diagnosis: laboratory test. 1. Hormone level, prolactin, GH, ACTH, TSH, FSH, LH. 2. Cortisol and dexamethasone suppression test. Imaging studies. 1. MRI of the brain, gold standard for detecting adenomas. 2. CT scan, Use when MRI is unavailable. Ophthalmologic evaluation. Visual field testing to assess optic nerve compression. Nursing diagnosis. 1. Risk for impaired vision related to optic chiasm compression. 2. Ineffective coping related to chronic illness and hormonal imbalances. 3. Risk for injury related to imbalance in hormone levels. 4. Disturbed body image related to physical changes due to hormone excess. 5. Knowledge deficit regarding conditions and treatment. Disease management. First, medical management. A. Pharmacologic therapy. 1. Dopamine agonists for prolactinomas. 2. Somatostatin analogues for GH secreting adenomas. 3. Ketoconazole metyrapone for Cushing's disease. B. Surgical management. Transsphenoidal surgery preferred approach for tumor removal. C. Radiation therapy used in recurrent or inoperable cases. Nursing management. 1. Monitor neurological status, vision change, headache. 2. Changes hormonal levels and symptoms. 3. Post-operative care. Monitor for cerebrospinal fluid leaks, infection. 4. Provide emotional support and patient education. Treatment options. 1. Medications. Dopamine agonists, somatostatin analogues. 2. Surgery. 3. Radiotherapy for recurrent or residual tumors. Psychosocial medicine. 1. Counseling and support groups helps patients cope with hormonal and physical changes. 2. Cognitive behavioral therapy address anxiety and depression. 3. Family education and support helps caregivers understand the condition. 4. Lifestyle modification programs encourage stress management and healthy habits. 5. workplace and social adjustments, support patients in adapting to work and social life. Prevention: 1. Regular health checkups for early detection. 2. Genetic counseling if there is a family history. 3. Hormonal balance monitoring for at risk individuals. 4. Healthy lifestyle choices to reduce risk factors. In conclusion, pituitary adenomas, though benign, can significantly impact a person's health due to hormonal disturbances and compression effects. Early diagnosis and appropriate treatment, whether medical, surgical, or radiation therapy, are crucial in managing symptoms and preventing complications. A multidisciplinary approach, including medical, surgical, psychosocial interventions, ensures the best possible outcomes for patients. Thank you. Have a nice day.